So I wanted to first, hello. Or raise the voice. I wanted to, thank everybody for coming this evening to our celebration. And this is Mr. Keith Robinson. He is fantastic. The caterers are Command Performance Catering. Wonderful, wonderful. And I'm actually going to, I have a few words, and I'm sorry because I always have to, write things down because I don't remember, and I want to make sure I remember everything. But I'd first like to introduce Mr. Marty Klein. Marty Klein came as a part of Millennium Dental. He came from California because they do training here in New York City now. And so I'd like him to be able to say a few words, and then I got some words to say. Okay, hold on.
Hey everybody. As Dr. Williams said, I'm Marty Klein. I work with Millennium Dental and the Institute for Advanced Laser Dentistry. We train doctors on something called the LANAP protocol, which Dr. Williams has been doing for 8 or 9 years, 11 years here, treating gum disease in a way that does not cut and sew and cause a lot of pain in the patients, and is just as effective. And at the IALD, we realized there is no such thing as a gum disease awareness month or ribbon, and so we made it. We started it. The ADA wasn't doing it, the AAP wasn't doing it, so we did it. And we could only go so far on our own trying to get each state in the union to recognize Gum Disease Awareness Month. New York was a state that we just didn't have luck with on our own, and Dr. Williams and her amazing staff here is the reason that Gum Disease Awareness Month has been recognized in the state of New York and in all 5 boroughs. On behalf of Millennium Dental and the IALD, we're very, very grateful to Dr. Williams and the entire staff here at Morningside. And this is an amazing evening, and thank you all for coming.
Thank you so much. Thank you.
And thanks for wearing the pins.
So yes, make sure you spread the word about gum disease awareness, because it is, such an important issue. So first, I'd like to thank CVS and Health First were also sponsors of this evening. So I definitely appreciate them, as well as, of course, Millennium Dental. I think it really happened a lot easier than I thought it was going to happen, but that's to the credit of a lot of great politicians who really understood how important it is, and they jumped on board right away without any hesitation. So yes, all the boroughs, including every single one of the boroughs, and oh gosh,
Congressional districts.
The congressional, everybody jumped on board basically. And thanks so much for them. I'd also, of course, like to thank Diane Thompson, who is actually the powerhouse behind all of this happening. A phenomenal woman, and we really appreciate your efforts for everything. Yes. Then I have to find the best dental staff in New York. Where are you guys? I'm here. I always tell people I really don't know how to choose who I bring on board or not. But the one thing that I do look at are people who are passionate about what they do. And everybody, all of the staff here, I'm so blessed and grateful to have them. And they all love dentistry. I watch them, how they care for the patients, and it's really amazing, and it makes me feel really, really good to know that you all are in great hands. For those of you who are patients, or those who are coming to be patients, they're wonderful, and so I love the office here. Next are the staff, are the patients. The other thing I tell people is I've got the greatest patients. The best patient. Because you all are. You know, I've been here in New York for 19 years and have been really overwhelmed by the amount of support that I've had throughout the years with the patients. And you know, sometimes people will say, oh, you know, some patients are fussy, some patients are... No, my patients, they come in, they are wonderful, they become part of our family. And I'm so blessed, grateful, and really privileged to have the opportunity to work with you all. And just want to let you know that I will continue to, you know, keep turning every page that I can and finding the latest techniques and the things that we can, you know, bring to improve our oral health care, because it is so important. It's so important, and I just appreciate that you all have allowed me the opportunity to be here and to grow the office the way we have. Next, the reason we're here. So I tell everybody that I'm going to keep talking until we have, like maybe Michelle Obama say, obesity, diabetes, stroke, gum disease as part of one, you know, symptom, you know. Because right now people are still thinking of gum disease, they're not paying attention to it the way they should, and they really don't understand how important it is and how the oral health affects the rest of the body. And so we've got to keep pushing, and this is really just the beginning. And I love the fact that it's in Harlem, that we're, you know, that it's happening. So often, like, we're at the back end. You know, we're always the ones, okay, you know, the African American, the Latino community are the last ones to find out about, you know, whatever health issues there are. But that's why it's so important that it started here. That made a big difference to me as well. And I just wanted to go, just reiterate a study about comorbidities, which says, you know, so they did some research with United Concordia, and they found out that for people who, say, have diabetes and have gum disease, if you treat treat the gum disease alone, you can reduce your healthcare costs every year by $2,800 a year. If you have stroke and gum disease, and you only treat the gum disease, you can reduce healthcare costs by $5,600 a year. These are huge things. It's so important. It's so critical. And then the final thing is just to remember that gum disease, it's chronic, it's silent, and it's contagious. It's chronic, silent, and contagious. And that's all I'm going to say, and thank you all. Oh, I'm sorry. Health first. Health first. Thank you so much for coming, and thank you so much for your help and assistance in sponsoring this evening.
Oh, you're very welcome. Thank you so much, and we definitely applaud Dr. Williams here.